To left, yes. Occipital bone consists of four parts. Here it is pars basilaris, this and this lateral parts, pars lateralis, and here it is squama occipitalis, squama occipitalis. And these four parts fuse together and forms foramen magnum. Foramen magnum. Squama occipitalis on external surface has protuberance occipitalis externa. Downward from this protuberance start crest occipitalis externa. Laterally from protuberance here and here we have superior nuchal line, linea nucha superior. From middle part of the crest we can see linea nucha inferior. Sometime maybe highest nuchal line, linea nucha superior. On internal surface we have protuberance occipitalis interna, internal crest occipitalis interna, groove of transverse sinus sulcus sinus transversa, and groove of superior sagittal sinus sulcus sinus sagittalis superior. And together all of these structures makes eminence, eminentia cruciformis. It's look like cross, eminentia cruciformis. Next, lateral part. Lateral part has on external surface it has condyle, condylus occipitalis. At the base of this condyle we can see canal of hypoglossal nerve, canalis nervi hypoglossae. Behind of condyle, that is fossa candidaris, and here it is maybe canal, canalis candidaris. It is absent in this model. And notch, jugular notch, incisura jugularis. On internal surface, the same we can see groove of sigmoid sinus, sulcus sinus sigmoide, here it is. And pars basilaris, on external surface, it has tubercle where pharynx attached. That is why name of this tubercle is tuberculum pharyngeum. Pharyngeum. That is occipital bone. Next, sphenoid bone. Sphenoid bone, that is a bone of the base of the skull, and pars basilaris of occipital bone joined and fused together with sphenoid bone this way. And at the age of 22, they fuse together and makes one bone, that is os basilare. Os basilare, that is sphenoid and occipital bone together after 22 years. Sphenoid bone consists of body, corpus ossis sphenoidalis, two wings, less and greater, ala minor and ala major, and pterygate process. Here it is, processus pterygaidus, pterygate process. Body of sphenoid bone superiorly has saddle, turcic saddle, sella turcica. Posteriorly it has dorsum sella, anteriorly tubercle, tuberculum sella, and on the floor of this cella we have fossa where pituitary gland take place. That is, name of this fossa, fossa hypophysialis, hypophyseal fossa. Laterally from sella turcica here and here groove of carotid artery, that is sulcus caroticus, sulcus caroticus. Inferiorly, body of sphenoid bone has apertura sinus sphenoidalis. Inside of sphenoid bone we have sinus cavities, sinus sphenoidalis, and these openings they goes into this sinus. And here it is crest, crista sphenoidalis, participate in septum of the nasal cavity. Lesser veins and greater veins and space between them, that is fissura orbitalis superior. Fissura orbitalis superior.
Greater vein means this whole part, right?
All of this structure, that is greater vein, and it has four surfaces. All of this surface of greater vein, that is facies cerebralis, here it is facies temporalis, here it is facies orbitalis, and smallest surface facies maxillaris, facies maxillaris. Greater veins has three openings: foramen rotundum, foramen ovale, and foramen spinosum. Foramen spinosum, it is smallest opening, foramen spinosum. In front of tuberculum cella we have sulcus chiasmatis, and this sulcus continues into canal, canalis opticus. Optic nerve pass through this canal, canalis opticus. And last, pterygate process, processus pterygaidus. It consists of two lamina, lamina medialis and lamina lateralis. Between them, incisura pterygaida. And at the base of pterygate process, we have canal, canalis pterygaidus. Canalis pterygaidus. And last bone, that is frontal bone. That is correct position of this bone. It consists of four parts: squama frontalis, pars orbitalis, it is paired, and pars nasalis, unpaired. Squama frontalis on external surface has two tuber frontale here and here. Space between them, that is glabella, body with pars orbitalis, that is margo supraorbitalis, and above of this body we have arcus superciliaris, superciliary arcus superciliaris here and here. Then internal surface has groove of superior sagittal side, sulcus sinus sagittalis superior, that is the same like here, sulcus sinus sagittalis superior. It continues into the crest, crista frontalis. That is all. Now, pars orbitalis, it has processus zygomaticus, zygomatic process. On internal surface, it has fossa where lacrimal gland take place. That is why name of this fossa, fossa glandula lacrimalis. Another fossa, it is impossible to see. It is small fossa trochlearis, and this fossa has spina trochlearis, but in artificial bone impossible to see. And incisura supraorbitalis, in the region of margo supraorbitalis, it is incisura notch. Pars nasalis has apertura sinus frontalis. This opening continues into the sinus, sinus frontalis. It is crista nasalis, and crista nasalis continues into the spine, spina nasalis. It is broken. Spina nasalis, that is continuation of crista nasalis. That is all. That is all. 3 bones next time.
Excuse me, sir.
Please.
So is this the point where the optic nerves cross?
Optic nerve pass through optic canal, and in this here, in sulcus chiasmatis, yes, you're right, optic nerves cross one with another and continues into optic tract. That is why sulcus chiasmatis, that is place where chiasma opticum, that is cross of the optic nerve take place.
So how to know whether this is medial or lateral?
What medial?
The wing?
Wings? Both wings laterally, because it is in medial part of the base of the skull. That is this and this. Of course, it is laterally. Here and here.
What is this and this?
Oh, that is this notch is incisura jugularis, jugular notch, on the whole skull. It's joined with temporal bone and makes jugular open, foramen jugulare on the whole skull. And it is fossa candilaris behind of condyle, and it is, sometimes we can see canal, canalis candilaris.
This area?
Oh, that is all of this part, part, that is pars lateralis, lateral part. Well, that is all.